Hey, Jason Tushman back here with episode 44 of Spot On Patient Acquisition, finishing up our three-part series on patient lifetime value. Today we're going to be talking about patient referrals, okay? This is the fourth pillar, if you will, to tactically executing the most out of your patient lifetime value strategy. So we're going to talk about first about lifecycle marketing, okay? In regards to generating referrals, you should have predetermined messages and predetermined times based on your exact relationship with those patients that you want to generate referrals. We've already talked about how this uses technology and things like that, but timing of these messages and the message itself is important. You don't just send out a blast email saying, send us referrals. You want to create essentially one-to-one messages to the right group of patients or bucket of patients so that they generate referrals in a way that's personalized. Second, events, okay? Events are a huge opportunity, okay, to generate lifetime value from referrals of existing patients. It's very simple. Bring a friend. Have an existing patient bring a friend to an event that you're throwing, and you're going to increase your patient lifetime value from the person that's bringing the referral. You're also lowering or essentially eliminating your marketing costs outside that of what you're doing to throw the event. So it's a very profitable way to generate referrals. And the reality is, from a psychological perspective, it's birds of a feather, right? Birds of a feather flock together. If you have somebody that's having aesthetic services, they're going to be talking to their friends about the aesthetic services that they've had from you. If you're an orthodontist, people that have a good experience with you are going to talk to other families about the experience that they had at your practice. So birds of a feather, keep that in mind when you're thinking about events and bringing referrals to those events with your existing patients. The third part is ask, okay? The ask is really important. What happens when a patient is in your office? Who asks to get the referrals from them, okay? When do they ask? What's the message? That comes down to staff training, okay? It should just not be a carte blanche, give your team the opportunity to ask for referrals. You want to train your staff, okay? You want to know who the best people are to ask that question, okay? Who's the person that develops the best relationship with those potential or with those existing patients? Maybe it's different by patient that's coming in. Maybe it's different by particular procedure. But you want to know who the person is that's going to ask, and you want to know what that message is going to be, very similar to the lifecycle messaging. So you have to have a planned, tactical way that the ask is done in the practice. The fourth is, which so many people forget, thank the referrer, okay? Thank the person that referred. That can be done with a phone call. That can be done with an email. That can be done in a variety of ways, but don't forget about that person that sends you the referrers, because you know what? They're going to send you more. Typically, you're going to have a smaller subset of people that send referrals, but those that start to send you referrals will send you more. So you want to really make sure that you provide value and gratification to those people for doing that. So again, patient referrals in regards to your patient lifetime value strategy, four-pronged approach, lifecycle marketing, throw events for bring a friend, make sure your team's set up to know who's to ask and what to say and when, and thank the referrer. Hope this helps you. This finishes our three-part series on patient lifetime value, and we look forward to seeing you next time.